Kiaii, and welcome to Kidney Plugged In. March is Kidney Health Month, and the Kidney Foundation is on a mission to spread awareness about kidney disease and your kidney health, which is why we are so pleased to have Dr. Mercedeh Kiaii join us for this episode to talk about how diabetes, high blood pressure, and other risk factors can damage the kidneys. Dr. Kiaii also talks about our kidneys in general, what they do, how they keep us healthy, and what we can do to keep our kidneys healthy. And since Dr. Kiaii's focus and expertise is in the area of dialysis, we've asked her to help dispel some of the mysteries surrounding dialysis and to explain what a dialysis treatment does. So don't go anywhere, because Kidney 101 with Dr. Kiaii is coming up next, right here on Kidney Plugged In.
Thank you for joining us today, Dr. Kiaii. It's such a pleasure to have you on the show.
Thank you for having me. It's a pleasure to be here.
So, Dr. Kiaii, what are our kidneys? Like, how many do we have? Where are they typically located in our bodies? And what role do they play in keeping us healthy?
So we basically have two kidneys, most of us, although some people are born maybe with one kidney, but there are two kidney shaped basically organs in the back, right below where your rib cage ends, right around your spine. So that's where they're located. And they're actually extremely amazing organs because they do so many different things in terms of your health, right? So obviously the thing that most people know as the most important function of the kidney is that they filter your blood and get rid of the wastes. So that's the most important thing. But they also make sure that all your minerals and your electrolytes stay in balance. And they also make sure that you can get rid of extra salt and fluid. So they keep all that things. If you drink too much fluids, then the kidneys will make sure that they regulate that and they get rid of it. They also produce a hormone that helps your body make blood. They also make sure that your vitamin D that you get from the sun gets activated. So they do way more than what we all think that they do, which is getting rid of the waste. They're actually extremely detailed organs that they do a lot more than just that.
And how common is kidney disease or kidney damage?
So it's very interesting, Teresa, because I think that if you actually look up the statistics, I think 1 in 10 Canadians will be diagnosed with kidney disease. It'll be at different stages, but the risk is 1 in 10 Canadians actually can have kidney problems.
Why is kidney disease called a silent killer?
I love that question because the most common thing that we run into is that when we tell people, oh, I'm concerned about your kidneys because, the function's low, and they'll say, but I feel fine. Because unlike the heart, where you'll have chest pain and that tells you that you are having an issue with your heart, you don't have pain with the kidneys. The only things that really would give you pain is if you have an infection or you have a kidney stone. But otherwise, you could be losing kidney function and not feel a thing. And that's why it's so important to screen.
And so is it true then you can actually lose 80% of your kidney function before you have any type of symptoms?
Absolutely. So usually it's around 25%, 20% and below that people start to actually have the typical symptoms of kidney disease and they become aware. So before that, you could have absolutely no idea, which is very scary.
So what happens when the kidneys actually fail and stop working properly?
So as people's kidney function starts to reduce, the usual first symptoms that patients will notice is that, they're maybe developing some fluid retention, right? They're starting to get some swelling around their hands, their legs. They also start to feel less energy. So they feel like they just don't have the same energy they had before and they're not able to do the same thing. They might get less ability to do exercise. And then sometimes you start to notice that your appetites change and that food kind of starts to taste a bit funny. You might start to get a bit itchy and the people start to lose their appetite, right? So and then as it progresses more, people actually start to throw up and that kind of things. But it's usually the appetite starts to decrease and people start to feel a bit nauseated. So lack of energy, some nausea, decrease in appetite, and maybe starting to notice that blood pressure is going up and they're starting to retain fluid. Those are usually the first symptoms that people will notice.
Wow. And what do the acronyms mean then? CKD and ESKD?
So CKD stands for chronic kidney disease, and it has, as I mentioned, different stages. So you could be considered chronic kidney disease stage 1 when you actually have 90% kidney function, But you have risk factors for progression of the kidney disease, diabetes, high blood pressure, heart disease, or you have evidence of other kidney dysfunction, which is like leaking protein in your urine. So CKD stands for chronic kidney disease, and there's 5 stages. And ESKD stands for end-stage kidney disease, and sometimes we call it ESRD, which is renal disease. But that's usually when people's kidney function is less than 15% and they're requiring dialysis.
So when should a person be concerned then about their kidney function and start really tracking with a medical team?
So usually, we like to make sure that anybody who's got a kidney function less than 30% should be under the surveillance and care of a kidney team and a kidney doctor. Usually when you're less than 20%, you need more monitoring and changing of dietary changes and restrictions, because the kidneys at around 20% or lower is not able to fine-tune things anymore. So usually that's when you need more help with the dietitian and perhaps some changes in medications, a bit more restriction with diet, etc. Usually when people are less than 15% is when we increase our monitoring significantly, because that's when you're much more at risk for further decline and requiring to actually start dialysis. Some people are sitting at 15% and are quite stable and they're monitored and their symptoms are well. We continue to monitor them, but we do like to have a plan in place by that time. And most of the time when your percentage of kidney function is less than 10%, that's when most people require to start dialysis. It could be 8, it could be 7 for some, but less than 10, most of the time you need to start dialysis.
So you mentioned some of the risk factors there, like diabetes and heart disease. Are there other risk factors or comorbidities that are associated with kidney disease?
Very good question. So there's lots of genetic abnormalities that put people at risk. So that's one thing that we need to know, genetic hereditary conditions. Then there's immune-related conditions. So people who have an immune-related disorder of some other sort, like lupus, systemic lupus, or other inflammatory conditions that can also affect the kidney. So those things would be also risk factors to the kidney. Certain infections can also put risk factors. So people have hepatitis B or have had hepatitis C, that actually poses a risk factor to the kidneys. And then obviously there's the traditional risk factors that most other people are aware of. So high blood pressure, any kind of blood vessel disease. So that's why we always discourage smoking and making sure cholesterol is good. So blood vessel diseases, and of course the number one cause of kidney failure, people on dialysis, is diabetes still.
And are there communities or cultures that are at higher risk as well?
That's a good question. I think more and more we're understanding the genetic component of kidney disease and understanding that in certain communities or certain race or certain countries, there's more risk of certain types of kidney disease. But in my opinion, I think that people who are also more risk are people who are remote and don't have access to having screening and education. So that is something that I feel like we can maybe do something about, but there's more and more also research being done that making us understand that certain communities and certain races have more risk of certain types of kidney disease.
And so you mentioned screening. How do you get screened for kidney disease?
So I think it's important that we all do see our primary care providers for the routine checks, blood pressure. I can't tell you how many times I've seen people and I said, well, how long has your blood pressure been high? And no one's checked their blood pressure for 4 or 5 years. So making sure that we have the routine physical examinations, blood pressure checks, cholesterol checks, but also having blood tests so that we're actually getting the test that we look at how much how well the kidneys are actually filtering the toxin. So as you may know, we look at the creatinine that's used in a formula, and it gives us the estimated kidney function percentage. And then the other important thing is the urine test, right? One of the first signs of, for example, diabetics getting involvement of their kidneys because of the diabetes is that they start to leak protein in the urine. And that's checked with a simple urine test done in the morning. Small urine sample, doesn't have to be a 24-hour collection, and we can check for protein leakage. And of course, if we see blood in the urine, microscopic blood, then we need to screen for other causes of kidney impairment, such as the immune-related ones that I mentioned.
And so is there a certain age we should get screened at? Like, is this for anybody seeing their family doctor they should be asking about?
Very good question. I think if you have a family history of kidney disease, then I think that we should be getting checked as early as possible. So even if you're, 20 years old or 15 years old, you should be getting checked, blood pressure checks, if there is a history of family history, genetic component. But I think that if that's not the case, then definitely after the age of 30, people should be getting screened with the usual things that we do. And for example, with a condition called polycystic kidney disease, when we do ultrasound screening to see if that is something that's been passed down, then at 30, we recommend that people should be screened with ultrasounds.
So we've heard about the EGFR test. Can you tell us how that helps, how that works and how that determines kidney function?
To get an estimation of the percentage of kidney function, the easiest way that we can do this is we do a blood test and we get a value called the creatinine. We check the creatinine. Creatinine is actually not a toxin. It comes from our muscles. So people who are more muscular will naturally have a higher level of creatinine in their blood versus someone who's less muscular. But what's interesting is that the creatinine gets cleared by the kidneys, just like other toxins that are very difficult to measure. Creatinine is not a toxin, but it's a surrogate for us. It's a way for us to check, and if it's not being cleared, then it starts to rise in the blood. So we check the value, and if it's increasing, it tells us the kidney is not filtering as well, and therefore other things are not being cleared, the actual toxins. And so we use that, and in order to get a percentage, we use a mathematical formula, which uses the person's age and their sex, and we put that into the formula, and then it gives us an estimated filtration rate. The glomeruli are the little factories or the little units in the kidney that are actually doing the filtering. But that's what the E stands for, Teresa. It's the estimated filtration rate. And just to let you know that with advances in other ways that we can check, we're able to now use something called cystatin C. That's a little bit actually even more accurate than using creatinine, but it's not widely available. But hopefully with time, it will become more available in all the laboratories, because creatinine obviously is going to be affected by your muscle mass, whereas a cystatin is not so much.
So what steps can a patient take if they've been told that they need to manage their kidney health? What things can they do?
So I think making sure that you do your regular visits with your doctor, and making sure those things that we've mentioned are checked, making sure that you do know what your blood pressure is. Many people don't know, they've been to see their doctor, but they don't actually know. And if you do have any history of even mild high blood pressure, it's important to take ownership and get a machine and check it and be on top of it to make sure that it's not staying high and that it's being addressed. Making sure that, we do screen for anything else like the diabetes, etc. Making sure that you have a healthy lifestyle. We all know that for taking care of our hearts and taking care of other things, but it's equally important for the kidney to make sure that we have a good diet, make sure that it's kidney friendly, so not excessive amounts of salt, not excessive amounts of animal proteins, making sure that it's a balanced diet, and making sure that we get proper exercise. Definitely sedentary lifestyles and having a higher body mass can definitely increase the risks of various different medical issues, including kidney disease. So it's really important. It doesn't have to be majorly strenuous, high intensity, as long as it's a regular 20-30 minutes of even walking a day, every day, it's helpful. So those are the main things I think that we all should be doing.
can we talk about what is dialysis specifically, and does it replace kidney function?
Excellent question. So what dialysis does is it tries to it replaces a small percentage of what the kidney is doing. So as we mentioned, the kidneys are doing a number of different things. So one of the most important things is that they clear the toxins. So when somebody's on dialysis, the dialysis process clears some of those toxins. It doesn't do 100% of what the kidneys was able to do. For example, hemodialysis on a usual prescription does about maybe 15 to 20% of what the kidney's ability of clearing the toxins does. So that's really important to know. One very important information to always be remembering is that the dialysis does not cure the kidney disease, does not actually make the kidneys better. And so a lot of people have the misconception that dialysis actually cures the kidney. It does not. It tries to replace some of that function. So the clearing of the toxins, the removal of the fluid, and correction of some of the minerals and the acid accumulation that occurs with kidney failure. But it does not replace the function of producing the hormone that we mentioned at the beginning of this session that helps to make your body make blood. It doesn't do those other functions. It just does about 15 to 20% of the function of taking rid of the toxins, removing the fluid, and getting the minerals in a bit more balanced level. And as we talked about peritoneal dialysis and the hemodialysis, with peritoneal dialysis, we have a tube inserted into the belly that we wait for it to heal, and then fluid through that tube is put into the belly cavity, and we leave it there. And that's where the toxins from the blood go into that fluid. And then that fluid that's now got the toxins is removed and fresh fluid is put. And then this kind of recurrent thing occurs, like either 4 times a day, where it takes a few minutes to do the exchange, or some people choose to do it overnight, where fresh fluid is put into the belly, the toxins are removed from the blood, and it goes into the tummy cavity, the fluid, and that fluid is gotten rid of and fresh fluid's put in and continuous. Hemodialysis is when a person's blood is accessed, so that's why we always need what we call vascular access. We hope to use a person's own vein and not have to use plastic, but sometimes we're forced to use what we call a hemodialysis catheter, where an intravenous catheter is put into a large vein so that when the person is hooked up to the hemodialysis machine, blood is removed through that intravenous catheter or through the person's vein if they have a fistula, and that blood is then goes through the dialysis machine through a filter, and the toxins are removed, the fluid is removed, and through the dialysis solution that's there, the electrolytes are put into balance. So that's what the process of dialysis is. But it's important to remember, it does not cure the kidney disease, and it does not do the 100% of a kidney function. It does enough to make a person feel well enough to be able to now have quality of life and live.
So Dr. Kiaii, you just mentioned dialysis. Is that one of the treatment options that are available for kidney failure?
So I just want to make sure that it's very clear that there's many different treatment options, and that's why it's important to be seeing a kidney doctor and a kidney team early on. In terms of moving forward with doing some kind of therapy, there's preemptive transplantation, which we're really trying to make sure that we provide as an option for patients. Again, if you've been seen early, we have time to prepare, we have time to see if there's possibility of living organ donation, and so that can always be an option. For some situations, there's conservative care is actually the better option for that individual, meaning that in their situation, maybe dialysis would not be something that is something that they wish to pursue, and so we can actually take very good care conservatively of the symptoms moving forward. So that's always an option for people, and they don't ever have to feel like that they don't have that ability to make that decision. Other than that, obviously, to replace some of the function of the kidney when time comes, then dialysis would be the option. And dialysis can be done in 2 different ways. We can either use the abdominal cavity to do it, or we can use the blood, and the first one called peritoneal dialysis, the second one called hemodialysis. So there is two different options. And again, we like to partner with our patients to make sure we choose what is the best type of treatment for them.
You hear about the dialysis options where people go into center. Are there any home options as well?
Of course, yeah. So in the past, mostly people felt that doing the peritoneal dialysis, where the abdominal cavity is used, was the only home-based dialysis therapy, because peritoneal dialysis is home-based, where people get taught, the equipment's made for them, they get trained, and they do it at home, and it's very nice. But now we also have the option of doing home hemodialysis, where you do use the blood, and the blood is cleaned through using a machine, but you can learn, and it's done with a much simpler machine that we use in the in-center. It's done at home. So absolutely, that's an option that can be done at home, and it's a very good option. It gives independence. It often can help you actually have much better clearance of the toxins, because you can have the option of doing it more frequently. And, most people think of hemodialysis as in-center, in the hospital, but there's also a lot of community dialysis units closer to home, which are much obviously nicer for the patient to be closer to home, and you develop a nice community with the other people who are in that area, and then even in the in-center, there's now options of doing overnight dialysis. So we call it in-center nocturnal dialysis for people who need more clearance, because it gives you longer dialysis, but also it allows patients to work. It's because they dialyze through the night, they wake up in the morning, and then they have their day for themselves. So I think that over time we've been able to provide more and more options for treatment and give some autonomy to people.
Are there reasons why you as a nephrologist might recommend one type of dialysis over another to a patient? Is there any barriers for patients?
Very good question. So I think most of us always try to first give the option of giving independence. I think if you can have independence and be able to do it from home, that would always be my first choice. Now, if peritoneal dialysis, sometimes that's not an option because you may have had a lot of abdominal surgeries and there might be a lot of scarring, and that might have interrupted or scarred the membrane that is then used for the clearance of the toxin. So that may not be a possibility, or the person's home may not be amenable to having everything, or maybe there's some other issues with physical abilities of being able to pick up the bags and stuff. So that might sometimes be an issue, but otherwise peritoneal dialysis, for example, in people who have heart disease, is a really good option because it's much more gentler on the body, and it kind of mimics what your own body does a bit more because it's every day and it's gentle, just like our own kidneys work every day, every minute, but gentle. For some people, hemodialysis would be a better option because for those reasons that maybe they cannot do peritoneal dialysis, or maybe they need more monitoring, or they have some other issues with regards to requiring more intensive fluid removal that can be done a bit more intensely with the hemodialysis. So sometimes hemodialysis is the better option, but most of the time, most people can do both. Doing the home-based hemodialysis, it would be wonderful, but sometimes some people, may have issues with being able to do it on their own because they're by themselves and to be able to hook themselves up. So sometimes those things can be a bit of a barrier, but most people could possibly do both.
Are there any common myths about kidney disease that you would like to set the record straight or dispel?
So I think one of the myths is that you are supposed to feel something. So when people are being informed that their kidneys are working at 30%, their first thing is, but I don't feel anything. So I think that's one of the myths, that maybe you should feel something. you should have pain. So you don't have pain with kidney impairment. You have pain if you have, as I mentioned, kidney stones or kidney infection or something. But so that's one of the big myths and some people feel that you can't live with just one kidney. So that's a myth. And obviously a lot of people donate their kidney and you can live with one kidney. I think those are the main myths that I can think of that people are often will say, hey, well, I don't feel bad, but how do I have kidney disease? And the fact that they should feel some pain. I do think that people feel like, okay, well, I have kidney disease, then I can't do anything about it, right? Or they think that, oh, I can completely reverse it now, right? So I think that one of the major myths as well is that when you have some kidney damage, then the chances are that you may not be able to reverse that completely back. Although there's some situations that do get better, but often you can't reverse it back, but you can do a lot to prevent the further or decrease the rate of loss. Instead of losing 10% of kidney function per year, which used to happen in the past when we didn't have all the knowledge about good blood pressure control, what medications help to reduce the pressure inside the kidney. People lost kidney function at much faster rate. Whereas now with the proper interventions and making sure that blood pressure is well controlled, diet is good, and that we reduce the protein leakage in the urine, that's actually a big cause of fast loss of kidney function. When we do that, we're able to reduce the rate of loss of kidney function to what is considered natural decline. So it's become that. So that's a big myth that there's nothing I can do. What's the point now? There's a lot you can do. There's ways to reduce that rate of loss and make your kidneys last way longer than we used to do way in the past.
Well, thank you, Dr. Kiaii, for joining us today. It was such a pleasure. I think I even learned some things today.
Thank you, Teresa. I can't tell you how honored I was that you asked me to be able to do this. It gives me great pleasure to see if I can give any kind of help to our kidney community. And I am so impressed with all the work that you and the rest of your team are doing with the Kidney Foundation. So again, thank you so much. It was an absolute honor to be part of this.